My name is Christine Noguera, and I'm the Chief Executive Officer here at Community Medical Centers. Community Medical Centers has a significant history of working to provide health care for marginalized, unserved populations.
Community medical centers began back in the 60s as an outreach effort of physicians, nurses, concerned people in the community because of migrant workers that didn't have access to health care.
So this group of volunteers, truly out of the passion and the goodness of their hearts, created a system of care by going out in the evenings along the sloughs, the riverbank, to provide care to farm workers. Over 20 years ago, we began our program around healthcare for the homeless, because that was recognized as a group of individuals who also were marginalized, did not have access to healthcare. And everybody has the right to healthcare, and that is our mission.
So my name is Brandon Michelson. I'm a community health outreach worker. We provide healthcare for the homeless out here on the streets and under the bridges and canals. Stop. Fever. Awesome. All right, my dude. Anything we can help you out with medically today? Okay.
Knock, knock. Anybody home? Outreach. How's it going?
Our main goal is to try and develop rapport with our patients and then eventually funnel them back into the clinic system so they can be seen by community medical centers. So basically what we do is we bridge the gap in between hospital care and field care.
So every morning between 8 and 10 at Stockton Shelter at their drop-in center, we're here providing medical care for any of the homeless or anybody that has medical needs. We also follow up any people from the night before or afternoon before when we do screenings for COVID. So anybody with symptoms, they get followed up and tested here.
Around 10 years ago, we also, in a very collaborative program, developed our Gleason House with the Gospel Center Rescue Mission. They donated the building, it was renovated, and we are operating it on the site of the Gospel Center Rescue Mission to provide a medical home for a number of individuals who otherwise would not have access to health care. Our program has continued to expand. Due to the COVID pandemic, people who are living in shelters live very close to each other. No such thing as physical distancing within a shelter. There needs to be that ongoing screening. Are you experiencing any symptoms? Do you have a fever? And if so, now what?
I've been here for 6 weeks. We come in at this time of day, we check in. We go through a process of a line. We're assigned a bed. The medical staff people come up, take our temperature, ask us questions about coughing, fever, any other problems that we may have. And then we just process through the line. We get a number, in my case, go to our beds, put our stuff down, make our beds, and go to dinner later.
We're not just about COVID. We're looking at the whole person. And what we have found is it's a great opportunity also to address other healthcare needs, not just physical health, but mental health. So we're being able to bring in our behavioral health program into this too. We have received funding from HealthNet for a van that in the past our staff, just like those early volunteers, put all their supplies in the trunks of their cars. And that's how they've been doing their outreach for years. But finally, we're going to have a van.
Primarily, I think it gives us a presence in the community. So when we're out, the homeless, a lot of them recognize our cars, but really they connect the van to community medical centers and all of us that are providing these services.
Then there's Project Room Key, which is a hotel where people who are high risk, not so much getting COVID, but if they happen to be exposed to COVID, they're in that high risk category due to age or chronic disease or other issues that they can get seriously ill. So the Project Roomkey was set up for those individuals, and our team has established an on-site clinic where we're Monday through Friday there to provide health care services, screening, follow-up, whatever it is that the individuals need. And we also are integrating our behavioral health into that program.
It's been great. I'm actually getting my appointments when I'm supposed to have them. I'm not putting them off because I'm being homeless. And today the doctors came by to check on me, which I hadn't had that happen for a while now until I got here.
I think that's something that a lot of the homeless aren't accustomed to, having people that have a friendly face, a welcoming face, and that's concerned about them. And it's really building trust and about building relationships.
We have an ongoing commitment to healthcare for the homeless. Ours is not just about the pandemic. It is not just about right now. Yes, this is a crisis for right now. But as we're doing these services, as we're doing the Project Roomkey, as we're doing the clinic at the shelter, the screening at the shelter, we're also talking about after or ongoing. Issues around homelessness is not ending. There will be individuals next year, who are still homeless and so we need better systems of support and care that is comprehensive. I think my point right now is just that as we respond to the crisis of the moment, we have to also be looking forward. We can't just be looking at this acute moment.